My name is Terry Mamounas. I'm the medical director of the Comprehensive Breast Program at Orlando Health Cancer Institute in Orlando, Florida. So our patients often ask the question of whether they should have a bilateral mastectomy when they present with breast cancer. And the question that I ask my patients is to make sure they understand that if they're desirous of bilateral mastectomy, there are some reasons for that, but certainly a bilateral mastectomy should not lead to reduction or prevention of breast cancer recurrence. Because there is no reason to think that the bilateral mastectomy will lead to prevention of recurrence of the original breast cancer, besides obviously to prevent a local recurrence in the ipsilateral breast. But if the contralateral breast has no disease, there is no reason to think that that will affect obviously distal recurrence. So I have to emphasize that to the patients, because I tell them that if bilateral mastectomies prevented all recurrences, everybody will have bilateral mastectomies and then nobody will ever die for breast cancer. But unfortunately, this is not the case. So what does bilateral mastectomy do? Well, clearly, the reason that we do bilateral mastectomies, or people choose to have bilateral mastectomies, even if the other breast appears to be healthy, is that the bilateral mastectomy prevents the occurrence of a contralateral breast cancer at a later time. If you keep your breast cancer patients are at higher risk of developing another primary, either in the ipsilateral breast if they have a lumpectomy, or in the contralateral breast, obviously, if they don't have bilateral mastectomy. Now, this new cancer, this is a new cancer. This is not a recurrence of the first cancer, but a new cancer that develops because these patients are at high risk for another primary. Now, that risk is not very high. It's estimated to be about 0.5% per year per breast. So between the two breasts, about 1% per year. Now, that is without any additional adjuvant therapy, but if you give the patient adjuvant hormonal therapy, adjuvant endocrine therapy, because it has an estrogen receptor positive tumor, then that 0.5% per year per breast becomes essentially like 0.2% per year per breast, meaning like in the next 10 years, between both breasts, there will be about a 4% risk of developing something. Or if you look at the contralateral breast by itself, it's about a 2% every 10 years if you take hormonal therapy. But if you don't take adjuvant endocrine therapy, it's about 5% every 10 years. So that's important, because a patient that is very young and has a long life expectancy, let's say a 40-year-old patient that has average almost close to a 50-year life expectancy, that 5% every 10 years becomes almost about a 25% risk, or even the 2% every 10 years becomes potentially a 10% risk. Now, a 10% risk of a new primary is not really all that different than any woman will have, because in their lifetime, a woman, 1 in 8 women develop breast cancer, so about 12% lifetime risk for breast cancer. So I discussed these numbers with the patients to educate them on what risk is there to develop another breast cancer. This obviously can happen over a long period of time. And typically, because we watch these patients very carefully, if that were to happen, we usually detect it fairly early, because we do imaging often, we examine them, and so on and so forth. So clearly, it's not so much the chance of developing another breast cancer, but also the chance of dying from that new breast cancer is actually very remote in general. So to make a long story short, so to speak, bilateral mastectomies have not really shown to improve overall survival. But the problem with bilateral mastectomies is in population-based studies, those patients that get bilateral mastectomies are usually healthier and fitter patients. So in general, when you look at the population-based studies, it shows that patients that undergo bilateral mastectomy, for example, live longer. And that's not because you prevent breast cancers, right? Because you prevent an opposite breast cancer several years later, but it's because of selection bias. So because you cannot really die if you didn't even develop a cancer of the opposite breast. And that's what some of the population-based studies show. But that confuses sometimes the patients, because if they look at the literature and say, well, these studies show that if I have a bilateral mastectomy, I will live longer, that is a bias estimate. So in fact, that's not the case. So bilateral mastectomy doesn't prevent recurrence, but it does prevent new breast cancers from developing. And for younger patients, that may be appealing. The second reason that people choose bilateral mastectomy is that if they choose to have breast reconstruction, sometimes they are desired to have the same kind of reconstruction on both sides to achieve good symmetry. So that's another reason. That's not related to the cancer. It relates to how the breast will look after mastectomy. So some people choose bilateral mastectomy so they have very symmetric appearance of the breast following. And of course, by the same time, they don't have to undergo mammograms and surveillance of the other breast. That's an appealing proposition to some patients. But usually the uptake of bilateral mastectomy is seen in the younger patients, not so much in the older patients, because the benefits from reducing contralateral breast cancer in older patients is much less given the age of the patient. Of course, the older you are, the less life expectancy, the less risk for contralateral breast cancer.